There's a lots of talk about cosmetic dentistry and putting veneers on the front teeth. And I call those veneers, clip-on ceramic fingernails for lack of a better term. However, there's also such a thing out called Lumineer, and people like me get confused. What is one? What is the other one? Which one is better? Tell us about it.
Sure. Lumineers are a type of veneer that has been developed to be what's called prepless. In other words, you can sometimes virtually take very little to no tooth enamel away in order to put that false front over the tooth. And I kind of describe a veneer in many cases like women have those false fingernails that they wear. This is a false fingernail for the tooth that's custom made to fit over the existing tooth, and it's glued or bonded to the tooth. The Lumineers, I think, work in certain cases, but they do add thickness to the tooth if you're not reducing any enamel away. So if you are trying to build a tooth that's too far in and you're trying to build it out to the other teeth, that works fine. But if you're doing a series of veneers and you're adding Lumineers and you're not really reducing the thickness of the teeth, the Lumineers will all look matched, but the teeth will be much thicker, and you're going to push out the patient's lip.
I see. So what do you say?
I generally use Lumineers in very limited circumstances. Maybe a young kid who broke a tooth, and I really don't want to reduce much more of the tooth that's remaining. I may use it in a selective case. For patients that want ideal aesthetics, the Lumineers are limited in that they're generally very thin, and it doesn't give the master ceramist the opportunity to do ideal aesthetic shading. Most people think that teeth are one color, where teeth are multiple colors, and individual teeth don't actually match. Some teeth are a shade darker than others in the mouth. So the problem is, if you get a series of Lumineers, if they're not absolutely exquisitely done, they tend to look like chiclets in some patients. The alternative is your natural prep veneer, which is pressed porcelain, where you have layers of porcelain where the master ceramist can build character into the ceramic veneer to make it more lifelike and yet luminescent, where light can travel through it and make it look like a natural tooth. So in most aesthetic cases, I like to do that prep type pressed porcelain as opposed to the non-prep Lumineer.
Okay. So basically what you're saying is that because the Lumineer is so thin that it can be put on the existing tooth without grinding it down, it has here and there some advantages, but at the same token, you won't get the real shade, color, and shape you actually want. It's like painting over a existing color in a house without stripping it down. One paint, it just, no matter what, you get the underlying paint a little bit shining through, and just don't get the exact full color. Well, all right.
In most cases, you'll get an improvement, but probably it's going to fall short of ideal expectations.
Got it. Is there a big price difference in those two? Why people, go towards one or the other one?
No, there really isn't a big price difference. I think the reason people do one more than the other is Lumineers have been marketed directly to the public, whereas your conventional prep veneers have not been. Lumineers are marketed by the company that makes the product, so that you see it in your Oprah magazine and things like that, whereas there's a whole bunch of different companies that make the porcelain that's used for your prep veneers, and they're not marketing directly to the country, to the public.
I got it.
People walk in asking for that particular brand of veneers. Most people that want veneers don't ask for a brand. They just say, I want veneers.
Okay, makes sense. And they probably market it a lot with no grinding, no injection needed, and of course most of us have a little bit of a dental phobia, so we go, oh, that must be good, I like that. And then sometimes not realizing that they need to live with those things for 10, 20, 30 some years. All right.
That's right.
Again, that should put people into the know here who listen to this video. Dr. Melnick, bye-bye.